How does this deal work? Can you tell us a little bit about what Duke LifePoint is going to pay and how the deal is going to be structured?
Can't talk about payment terms. The structure is Duke LifePoint is a joint venture between Duke Health System and LifePoint Health. Joint venture and company was created in 2011, and they are part of a large organization, LifePoint Health. And that organization has made a proposal. They were in the bidding process with 18 other health systems, and the health system board narrowed it down to 4, and then did a further vetting review of their proposals and how they stacked up with the objectives that the health system created, and Duke LifePoint came out on top. So they have signed a memorandum of understanding with Duke LifePoint that allows them to move forward and work with the county on amendments to the lease, Gray County lease between Good Shepherd and Gray County, and also contingent upon approval of those amendments, go through a due diligence process. Once those 2 steps are done, then we'll have a definitive agreement in place, and then subject to federal and state approvals, we will become part of the Duke LifePoint Health System.
Good Shepherd has had several downgrades to its credit rating recently and is carrying millions in bond debt.
Correct.
Is the suitor paying off that debt? How much is that debt, and what else will they pay, if you can say?
Well, again, can't talk about the price terms. That's just things we can't just go over. But I will say that the proceeds from the sale of Good Shepherd to Duke LifePoint will result in the full payment of the bonds in total, and it will also result in a net proceeds which will go into a foundation, benefits of which will go towards community health in the areas that we serve.
Your news release says that Duke LifePoint has committed to making significant capital improvements in technology, equipment, and facilities here. Can you help us first understand what that means?
In the last 3 years, and really if you look back at the last 10-year cycle for Good Shepherd Health System, our capital has been mainly around replacement. Thankfully, through the work of the foundation, the auxiliary to help augment that through the purchase of equipment or the renovation of units has helped us stay, competitive. What Duke LifePoint provides, though, is access to significantly more capital for replacement, investment, expansion of services. So they're committed to investing in the Longview market, the Marshall market, the markets that we compete in to grow, because they see a great need for improvement of access to care in the region we serve and an investment in those programs.
What are some of the improvements that we will likely see?
We'll go through a strategic plan review. So after the lease amendment is completed, and then after the due diligence is completed and we've signed the definitive agreement, we will jointly go through with Duke LifePoint a strategic planning process that looks at community need, capital needs, areas to grow in, and based on that, we will create a capital investment program, a recruitment program, a training and education program, and unlike what we've tried in the past is create that on our own through the resources of the Marshall, Longview, and GSMA operating entities. We'll have the power, the strength, the experience of Duke University Health System and LifePoint, and that's what will drive our strategic planning.
Obviously, it's not going to be something that's going to be quick, but are there physical changes or things that residents, patients, people who depend upon this health system will be able to see over the coming months and years through this?
I think it'll be very visible over the coming years, and we'll use the next 6-9 months to develop that strategic plan. So where there are health needs and where there's care that people are leaving our communities to other communities, and there's quite a bit of that, folks will see services, recruitment, physicians, where you don't need to leave your local community for health care.
I wanted to know how many employees are here at the Longview facility as well that work here in Longview in Kilgore and in Marshall, but how will this affect employees, if anyway?
The whole concept of this transaction is that there's need for services in the community that are not being provided. The other is that Duke LifePoint brings operational and clinical effectiveness and performance that mean improvements. So the combination of that means that we will be growing as a healthcare organization. And with growth, we'll either become more productive, more efficient, and provide security to people for the jobs they have. And with appropriate growth, we will probably be able to expand our employment. But all that's dependent upon the strategic planning, on our timeline for implementing that. One of the goals that the system set was to protect jobs and protect employees. I will tell you the route that we were on was not going to lead to that. Our successful merger with Duke LifePoint will give us great stability.
This acquisition includes each and every employee within Good Shepherd's Health.
Yes. If I can pass a drug screen, I'll still have a job.
Are there any parts of what we consider Good Shepherd properties that are not included in this deal, which I think you just...
No, it's all, yes.
So it's buying all the clinics, the doctor's practices, the institute as well.
Correct.
Could you tell us a little bit about how the deal will proceed from here? Well, of course, there's going to be the discussion on the lease agreement and possible action at Monday's county commissioners meeting.
Well, they'll meet on Wednesday. I think it's a Wednesday meeting.
Sorry.
And the commissioners will have a resolution to vote on and approve for a public hearing that will be held on July 18th, at which time the amendments to the lease will be in front of the county commissioners for approval. And we think it's in the best interest of Gray County, Good Shepherd, Northeast Texas for those lease amendments to be approved. Once those lease amendments are approved, then the Duke LifePoint teams will go through with Good Shepherd, a pretty robust due diligence review to make sure that we all line up appropriately and the agreements are assumable. It's just part of any business transaction. Once that is completed, we will sign a definitive agreement between Good Shepherd Health System and Duke LifePoint. And once that's done, subject to both state and federal approvals, which we don't see any concerns in those areas, we will become part of Duke LifePoint. And all that will happen throughout the remainder of this year.
Okay, and that, of course, answers, I guess, what we're going to see after Wednesday's meeting as far as completing this acquisition.
It'll be just the announcements made for resolution to be on the subsequent county commissioners meeting for approval.
Duke LifePoint is a separate joint venture from LifePoint Health Systems, which of course LifePoint has the hospital in Palestine, hospitals in Ennis, Mahia, and Minden. Does that in any way mean that in some aspects we will be sister hospitals or not? I mean, is it a completely separate?
We become part of Duke LifePoint and believe they have 14 hospitals today. We will be the 15th hospital. So our board approval, organizational structure, decision-making will flow from the two hospital boards, the GSMA board, up to a division within Duke LifePoint. There is a support services that supports both LifePoint hospitals as well as Duke LifePoint hospitals. The individual hospitals that are LifePoint in Texas are not part of Duke LifePoint, but they're still a resource for us to talk to about how they do things, how they've improved things. So we really have gone from two hospitals where we can share knowledge and how we accomplish things and how we attack problems, make improvements, to 14 with the Duke LifePoint, and really access to 70 hospitals, 70 plus within the LifePoint health system. So it just greatly expands the networking capabilities, opportunities for our physicians, our clinicians, our operators. It's a good thing.
Correct me if I'm wrong. A Champion EMS is involves both Good Shepherd Health System and Trinity Mother Frances Health
Correct.
System. I know that they are becoming affiliated with Christus.
Correct.
You have your affiliation with Duke LifePoint.
Correct.
How will those factors potentially affect that EMS service?
Well, first, the EMS service is a great service, phenomenal care, staff, and that partnership with Trinity Mother Frances continues today. That will be one of the pieces of the due diligence that's reviewed, and we will have conversations with Trinity Mother Frances and Christus on how that program evolves and grows. But if you're an employee of Champion Health or Champion Ambulance, you have nothing to worry about. They provide great service. They're running their trucks today. They're making improvements in their services and response time today. That's still a great service to both the Tyler surrounding communities, Longview and Marshall surrounding communities.
Give you a chance to, I guess, alleviate concerns from residents, patients who have become accustomed to Good Shepherd being always a local hospital, a locally affiliated hospital. More and more hospitals are going to larger affiliations. What would you say as far as people's concerns that it's going to mean less of an emphasis on local services or local support of community service ventures here?
Yeah, the interesting thing about Duke LifePoint is when we met with them and we did site visits, our board did a very robust site vetting of each organization. Many of the Duke LifePoint hospitals are the sole hospital, are community-based. They're the support center for care in their communities. And so they have a strong commitment to maintaining the access for charity care, indigent care. Others, one of the things that stood out with Duke LifePoint is their emphasis on local governance. And all the discussions that we've had with the leadership of Duke LifePoint is, how can we help you? What do you need? It's not been an issue of do this, don't do that. It is what we've really been seeking, is resources for local community, for growth in the local community. There are no surrounding larger facilities that care will be leaving and going to. It's going to be a strategic focus on growth and services to meet the needs in East Texas. So this is very good for us.
Anything else that you'd like to say about this announcement?
The system board set objectives in place. They surveyed, interviewed 18 organizations, looked at, reached out to. They spent almost a year reaching this decision. Wasn't an easy decision. The great news, and really also the challenge, was there are so many great health systems, qualified health systems that lined up with our objectives, with our goals. And thankfully, the one that we chose at the end of the day was the best of the best. It will add value to us, will add capital to us, will create tax revenues that didn't exist before, will result in a net proceeds, create foundation support for community health in our counties, and will continue to keep the Good Shepherd tradition alive and well for years to come. And the board just did a great job of making that decision.
One final thing, Duke University has a level of respect in the healthcare community for particularly its clinical services.
Yes.
Considering what transpired here almost 2 years ago as far as with the dialysis issue, how will this affiliation be able to better help the hospital if ever a future situation like that should arise?
Well, I'll say two things. One is that with or without Suter, the management team, the physician leadership board's taking actions to improve on where we were 2 years ago across the board. Two, the Duke LifePoint folks are not worried about compliance, are not worried about improving quality. It's one of their strengths, and it's also something that we look to that said, well, if we can improve from where we were to where we are today, think about how much better we'll be with an alignment with Duke LifePoint. Because you're right, they have strength both in the LifePoint hospitals as well as the Duke LifePoint on quality. Every one of their board meetings are on quality. All their system, Duke LifePoint discussions throughout their organization covers quality. They cover it before any other aspect of the business. This will make us even better.